I remember our SPM, the social and preventive medicine, used to be tucked away somewhere. It was useless. Nobody cared. Any medical curriculum that regards community medicine as unimportant is, to my mind, a worthless curriculum. It's doing great injustice to society and to the student, the medical doctor in future. Take your responsibility seriously. Understand the health profile of this country. We have the Director of Medical Education here. While our education is pretty good in many ways, there are some serious deficiencies. I remember spending an year or so studying the mitral stenosis and the mid-diastolic rough and rumbling murmur as an undergraduate student in the first few months of clinical life. It's a ridiculous way of teaching medicine. The same kid does not know how to save patients, management of medical emergencies, or how to deal with the large number of patients who come to us in this country, in our environment, with what we call, quote-unquote, tropical disease, again tucked away somewhere in the corner in general medicine. Whereas in real life, the patients you face are those in large numbers. And we are hardly ready to face them, to deal with them, to treat them. I remember the trepidation I felt when I became an intern and I had a post-operative patient. I had a very silly doubt. Today, in retrospect, a ridiculously silly doubt, but in those days it was a very weighty issue. Do I prescribe to control pain an anti-inflammatory? Because anti-inflammatory and analgesic properties, they go together. Because after all, for a post-operative patient, what you require is inflammatory action in order to have the healing. And if I use analgesics, it may be anti-inflammatory, it may do actually harm to the patient. It is a very silly doubt. But that doubt was never cleared by my teachers. Only experience taught me. There are many, many more doubts. I remember in my first posting as a civil servant, as a sub-collector in Narsipatnam, one day I received a phone call. My Tahsildar telephoned to me and said there was an accident and the patient was badly injured. And he said he was in serious condition, quote-unquote serious, after all a layman. That's the only language he knew. So I called the Taluk hospital, some 50-bedded hospital there in Narsipatnam. I said, can I speak to the duty doctor? He came on the line. I said, doctor, I understand that there was an accident and some patient was brought in with a head injury. Could you please tell me his condition? This doctor said, serious, sir. I said, you're a doctor. What do you mean serious? Is he in coma? Is he conscious? He said, sir, he's not conscious. I said, what is the stage of his pupils? Hutchinson's 4 stages, first, second, third, fourth. Could you please tell me? He said, sir, I did not examine his pupils. I said, what? He's a head injury patient, he's in coma. You did not examine his pupils? He said, sir, I don't have a torchlight. You have to give me some answer. I said, what's his pulse rate? He said, sir, I did not see. I did not check.